Today's guest is Tim Randall from EZaccessMD. Going to bring Tim in a second. Thank you for joining us. Benefits with Friends is all about really trying to get benefit decision makers together in a place where we could just help spread some awareness, talk about some things that the status quo doesn't necessarily talk about, help employers understand that there's an entire alternative universe of healthcare and health insurance that's growing very rapidly behind the scenes. The point of the boo is that I see myself as a benefit optimization officer. It's just another name for broker, advisor, consultant. But I really don't, like those other terms because their central focus is really that we're selling someone a product, an insurance product. And, for 25 years, that's what I did. This is my 30th year in the business. So for the past 5 years, really been on a different journey to try to help, dig deep, find alternative solutions that really can help employers change the trajectory of their healthcare costs, which is what impacts the health insurance costs, and really do that in a way that helps them offer products to their members or insurance products to their employees, their members, that don't involve increasing out-of-pocket costs and passing more cost on to employees. So benefit optimization, as the name implies, is the process used by HR professionals to critically assess an organization's benefit structure and determine what changes can be made to make the benefit package on offer best serve the organization and the employees. And I can't think of anything that's more crucial for companies to do in this time of great resignation. Getting employees is tough. Keeping them is even tougher. And one way to do that, I believe, is to offer them just a really exceptional benefit plan. It's a form of compensation that, should tell your employees exactly how you feel about them. It requires a little bit more work, especially for us, my team and our solution partners, but we're committed to it. And the reason why we're committed to it is that there's probably more than this, but I've kind of identified 8 core issues with status quo benefits and healthcare. One is a lack of transparency in price and quality. There's a very low provider-patient engagement. There's so many hidden profits in the prescription world that it's probably much more than 30%, but that's being kind of generous to that whole ecosystem. Healthcare steerage within the healthcare systems, the hospital systems that own really now every single step of the healthcare world, and that is the sole purpose of that, in my opinion, is to drive and increase profits. It's not to where the care is best for the members; it's where the profit is greatest for the healthcare system. There are so many different misaligned incentives, no control of plan documents, and there's abundance of unnecessary care. And so we talk about a lot of solutions. We talk about solution partners. I'll bring Tim Randall in a second. But the solutions involve care navigation, getting people to the best doctors, getting them the very best healthcare. And very often when we do that, it lowers the cost, completely contrary to the status quo. We want to build plan designs that incentivize employees to seek out the best care, reward them for making better decisions, not penalizing them with high out-of-pocket costs just, randomly throughout the plan design. We want to try to incorporate transparent open networks, control the plan document, incorporate direct contracts, which is a little bit about what we'll talk about today, work with independent TPAs, independent pharmacy benefit managers, and really enhance the whole primary care system. So without further ado, I am going to bring Tim Randall. I assume no relationship to Tony Randall, as I'm thinking about it.
I've been sworn to secrecy, so
okay.
I can neither confirm nor deny.
Yeah. But Tim is with a company called EZaccessMD, and might be something that some people out there are aware of, especially if there's any benefit advisors that are kind of in our world out there. Thanks for joining today. Tim, how's it going?
It's a pleasure to be here. It's going great.
Awesome.
Thanks again for having me. This is a great opportunity to learn and to share. So appreciate the opportunity to be here today.
Yeah, no, thank you. Thank you for agreeing to join. If there is anybody out there, knock, knock. If you want to try chatting, I have a separate screen open because StreamYard, which is how we kind of host this show, doesn't allow me to chat through LinkedIn, but I have LinkedIn open on the other screen. So if there's any questions as we're going through the show, I'll try to pick them up and address them. So thank you. Yeah. So EZaccessMD, I want to, give you an opportunity first just to introduce yourself, introduce what your company does, and we'll get at it.
Sure. Yeah, so my name is Tim Randall. I'm the director of sales for EZaccessMD. And EZaccessMD, if you haven't heard of us, we are kind of revolutionizing how healthcare is delivered in a lot of ways. And I guess the best way to think of us, and this is a term that's been coined by some of our customers when we explain to them what we do, is that we're telehealth on steroids. So we offer traditional telemedicine, but we have some mobile diagnostic capabilities that can actually bring certain services like x-rays and lab tests and a variety of other things to an employee's home if they're enrolled in the program. So that's kind of what we do. And we're growing every day and helping to bring about change in the healthcare system, much like you are, and advisors that or boos that think the way you do, that, there's better alternatives out there. And one thing that I've learned along the way here is that it is possible to have better benefits and actually be able to save money. So, much in the way that, going to a high quality center for surgery or something like that, oftentimes costs less. It just seems counterintuitive that could ever happen. But I think that we provide that same sort of a dichotomy, if you will, where you can enhance your employees' benefits and be able to save not only the employer money, but the employee themselves too.
No, that's great. And people out there, HR directors, benefit decision makers that are just, they buy insurance plans, and very often they don't see the hidden profits, right? The way that the managed care system, both on the health insurance side, right? Those are the plans we sell. And on the healthcare side, doctors, the whole clinical world of healthcare is embedded with managed care, right? And they're really two very huge forces fighting for profits. They're in some cases publicly traded, in some cases not for profit, but their goal, the whole point of them doing business is to make money. They have to do it, and hopefully the clinicians themselves are doing it, obviously, for the best interests of the patients. But they work within this ecosystem that tells them how to do it, right? Doctors all the way down to primary care doctors, not that they're down, but they're the gatekeepers, right? That's where most people enter into the healthcare system. They now have a boss that is profit motivated, right? Private equity money. And, many of them have now become employees or very closely embedded with the healthcare systems that don't give them the freedom to direct care where the doctor sees fit, right? And they don't provide the clinicians with the information regarding price and quality either, right? They just tell them, this is where you send people.
Yep.
If people need an MRI, this is where you send them. If they need a CAT scan, if they need a sono, if they need anything, you name it, there's fewer and fewer things every year that primary care doctors have the ability to do in their office, either because the state disallows it or their boss now says, we can make more money somewhere else. Here's a piece of paper. I'm very conscious of it, especially in the last 5 years, because, when I started reflecting on all of the change within healthcare, it occurred to me like, once the primary care doctors started working for the healthcare systems, they no longer verbally told me where to go for services. They pulled out a piece of paper that was very carefully curated for them by the healthcare system that they work with, right? And just recently, I was with my daughter, and she was being referred for an MRI, and we were at a large healthcare system here in Long Island, the largest employer in New York State, by the way. And they pulled out a piece of paper, and they made it as if you had to go there.
Yeah.
I'm a ABC healthcare system employee, doctor. You have to go to the facilities. And that's something that a lot of people don't understand, is that, you can go anywhere you want. Now, there might be some limitation, because if you're still within a carrier network, which most people are, and you're going to want to try to stay in network.
Right.
but there's still independent facilities, within that network. So, so under your model, under the EZaccessMD, and by the way, obviously telemedicine or telehealth, I don't know that there's really a difference. If there is, you could tell me, but telemedicine has expanded exponentially over the last couple of years because of the pandemic.
Yeah, that's absolutely true. It's something that's been around for quite a while, but was sort of underutilized, and with the pandemic, obviously it became much more commonplace. We're kind of forced into it, and I think people realize that, hey, this is for certain things, this is actually a pretty good way to go.
Yeah.
And it's become more acceptable, and I think that that's really what's helped to accelerate our growth, is just this shift in the mindset and the acceptance of this form of medicine.
Everything else in our lives, everybody's lives, right? At least here in the U.S., is so centered on technology, on their mobile app, on their computers. But for some reason, when you try to bring healthcare into that, there's just this, immediate resistance to change that exists, right? Like, that's not my doctor. But with the pandemic, people couldn't go to their doctors, but they still
Right.
needed care, right? Not all non-essential care was, at least in New York, and I know that probably, over time, probably most parts of the country, stopped it to some extent. Telemedicine really was crucial for people with, existing underlying health conditions. They
Yeah.
needed a doctor. So once you get past that, now you're on the phone with the doctor. Maybe it's a little bit more advanced. Maybe it can't be resolved with just talking to a doctor. So that's the other mobile aspect to what EZaccessMD does. Am I right?
Yeah, exactly. The whole experience starts with a consult with a telephysician, who will listen to the patient and find out what's going on. And truth be told, a lot of the that initial consult, a lot of things can be resolved there. But what if you need a strep test, or what if you need a flu test, or what if maybe you need an X-ray? With traditional telemedicine, you're going to have to leave your home or your place where you're working or wherever you are and go to an urgent care center or to a hospital. And so there's the convenience factor of not having to do that, because we can basically come to your home and do 85% of what an urgent care center can do, but we can come right to you. So right in the convenience of your home. And you were talking about how people have things on their phone. People want things to come to their home. They want things like Grubhub and Instacart, all these things to come to their home. And we're one of those few options where healthcare can come to your home, essentially creating a house call like the good old days. So that convenience is there. And the way we've got this modeled out too is that it's a per employee per month subscription, if you will, that's paid by the employer. So the employee doesn't have a copay. They don't have a deductible. They're not going to get a bill in the mail, because this doesn't generate any sort of a claim. So so it's very convenient for the employee to use. And because a lot of them are on a health plan, but sometimes they can't afford to use it. So this is giving them, access to healthcare, and, early on too, before things get worse, where maybe you do need to go to the hospital. So, it's just great to be able to do more in one day. And thanks for bringing this slide up, but this kind of really explains in a nutshell what we do, bringing that telemedicine, combining it with this in-home urgent care with our mobile diagnostics. It just allows us to get more done in one day, and to, get you on your path to wellness quicker, not having to, hang up the phone even with a teledoctor and having to go to urgent care to get an X-ray, or to go get a strep test, or to go see your own doctor, because sometimes it's not easy to get into your own doctor. And this certainly does not replace primary care. Like, primary care is probably the most important doctor you can have in your life, but sometimes they're really busy. So this maybe even helps them to be better at what they do by offloading some of these lower acuity things that can be handled in the convenience of your home.
Well, that's the thing, is that because of the managed care insurance plans that are being sold, so many people have high deductibles, even
Mhm.
HSA style plans where there's a $1 deductible
Mhm.
that applies to all services except for, routine adult and well child care. So they avoid care, but there's definitely circumstances that you can't avoid that care. So now
Right.
you don't know where to go. You probably, even if you're lucky enough to have a primary care doctor, you're not seeing that doctor today. 99.4% of the time, there's going to be a wait,
Yep.
right? Because they are so overburdened with patients. The average primary care doctor probably has about 4,000 patients. So now, as by default, people go to urgent care. Well, the cost for the same services at urgent care are going to be 50 to 100% more than at a
Yeah.
primary care doctor, right?
So as an employer, you're especially if you're self-insured, you're going to be writing the check for all of those claims. And
Right.
so how much does that X-ray cost compared to, if you're paying this per employee per month fee with EZaccessMD, and we're coming to your house to do the X-ray? There's probably a big difference there, and not to mention the
Yeah.
convenience of it as well.
Or even just people who avoid care completely, right? Because they
Right.
know they've had the experience last year. They had the same out-of-pocket cost.
Mhm.
They were sick, maybe flu-like symptoms, maybe really, really bad throat, and just assumed it was nothing. Next thing you know, they're in the emergency room, which was the last place they wanted to be.
Yeah.
Now they're looking at a claim 1,000, 2,000, who knows, depending on what they want to do. Sometimes, you don't look right. We're going to keep you overnight.
Mhm.
So that becomes an excessive claim. It impacts both the employer and the employee. People don't think about it, but the employee has the out-of-pocket exposure. But all of those claims that could have been handled maybe at the primary care type setting, but they're just not any access to that today, now are impacting your claim spend, right? They're impacting your claim spend this year, which means they're going to impact your premium cost next year. So what I'm sure you have a number. I'm not sure if it's in any of these slides. Maybe by the way, before I move slides, so this is an example in the middle of what one of your what do you call them? Mobile trucks, I guess, is a mobile.
Yeah, what do we call them? Yeah, I guess they're just like our mobile vehicles, I guess, is what we call them. But yeah, this is a picture of what would show up at your house, and you can see that that's the X-ray unit that's being unloaded, and those two suitcases to the right, those contain some of the other some lab tests we can do, like for strep and flu and UTIs. There's also some devices in there that allow the technician to be able to look inside, say like a young child's ear that maybe has an ear infection,
Mhm.
and an image can be sent to the teledoctor, who's already already knows what's going on and has ordered this service to go in there to get further definitive proof of what is going on, so that those images get sent back to that teledoctor, and they can tell if there's an ear infection, and they can write a prescription, and you can go pick it up at your pharmacy. So just in the simplicity of just being in your home, they're able to do that stuff very rapidly. But that's what's in these suitcases. So there's different devices like that allow them to just get further information that traditional telemedicine just doesn't have at this point in time.
So this is triggered by the doctor, right? The
Yeah,
telemedicine provider. That's the first step, is the
yeah,
board certified physician that we see here. And then
exactly.
what
Yeah,
are
so
what are the credentials of the people that come to the home?
yeah, so that's a great question. People often ask, like, how do you pay these doctors to come to your house? So just to be transparent, there isn't going to be a doctor that comes to your house. That's the person that you'll speak to first via telemedicine, and they order the different services that might be needed to get more accurate diagnosis. And
Mhm.
the people that come to your house, it's going to be somebody who's trained and licensed to be able to deliver the service that's being ordered, be it an X-ray or be it some sort of a lab test.
Just like in the doctor's office, right? That you see
Yeah,
the doctor and they say, John Doe's going to be in a second. They take you into the other room for the X-ray, or
yep,
we're gonna do the swab, to do a rapid strep and then we'll send a culture out, right? It's
yeah,
not usually the doctor that does that. It's
right,
a
exactly. It's
technician,
somebody
right?
in the office. So yeah, very very similar to that. And this next slide really just shows where the similarities end with traditional telemedicine. You can see that it really ends with being able to write a prescription. And this looks like this chart may be a little out of whack, but basically with traditional medication, traditional telemedicine, you'll have the consult video or phone consult. They
Mhm.
can write you a prescription, but they can't do things like EKGs, ultrasounds, X-rays,
Right.
echocardiograms. All those things are listed up above. So that's really where the differences
Yeah,
occur
this
with
is,
traditional telemedicine.
yeah, I think the chart got skewed a little bit somehow,
Yeah.
being pulled into the StreamYard. But yeah, no, you could see though that it's much more um, comprehensive than just having the ability to call a,
Yep.
a primary care doctor. Um, what
Yeah.
is this?
On
So yeah,
this.
20% of all Google search is for healthcare. That's
Yep.
amazing.
Yep. And there's a spike in those type of searches at 7 a.m. And this graphic here, this is an actual screenshot taken from Indianapolis, it looks like. So we probably presented this slide deck to somebody out that way. So we just want to demonstrate in their backyard. And tomorrow morning at 7 o'clock, if you do the same Google search where you live in the New York area, you'll probably see the same results. Like you'll get these results that'll show
Mhm.
that they're closed at 7 a.m. They may open at
Right.
8 or 9 or maybe later.
Yeah.
They're not open 24/7. So our telemedicine is available 24/7. And during basically 16 hours of the day, we're able to provide the mobile diagnostics in the areas where we have that type of coverage. But we're there 24/7, 365. I had my son actually use the service for the first time on Mother's Day. He woke up with a swollen eye, and then
Ooh.
my other son actually sprained his ankle playing lacrosse on Tuesday night, and I called kind of later at night. It was after like the mobile service hours, but they sent somebody out that very next morning. They were in and out in 15 minutes, and I had also the results of the X-ray within about definitely within the hour, but it's probably more like a half an hour to 45 minutes. So
Right.
that was pretty cool.
My my oldest will be 30 this year. So when he was about a year old,
Uh-huh.
we were living in Oceanside, New York, or East Rockaway to be more
Yeah.
specific. And he was up in the middle of the night, and he was a difficult child. I love him to death. But he was
Is he the
difficult.
middle child?
Yeah, nah, yeah, but he woke up screaming and yelling, and put him down, and thought, maybe he was hungry, didn't really know what was going on, and he fell. He tripped over my big sneakers.
Uh-huh.
And my wife is a at the time was a NICU nurse, neonatal
Okay.
intensive care nurse, and he was screaming bloody murder. Couldn't talk. We didn't know what was going on. Tried to call the pediatrician. At the time, we had a gated HMO style plan. It was
Uh-huh.
our first experience with managed care plans. Probably like a $5 copay or $2 copay back in the day. But we needed referrals. We had selected a primary care doctor, tried to reach the pediatrician, got the service.
Uh-huh.
In the meantime, when I tell you screaming, he was screaming. We were a wreck. We just decided to pick him up and go to the emergency room that was probably 3 miles away,
Mm-hmm.
South Nassau Community Hospital. And we actually had a family member that was a nurse in the emergency room. He helped guide us, to get us, care pretty quickly. They knew us. They knew the baby, knew something didn't seem right. And at the end of the day, he was fine. He was a bruise. He twisted it, or he's just being very emotional, but wasn't broken. And I got a denial from the insurance company for non-emergency use of the emergency room, which, I don't take these things personally. I understand that it's not really a human being looking at the claim. The diagnosis was a twisted ankle. That's not really an emergency, so they declined it. I appealed it, of course, and we won because I'm not a doctor, but my wife is a nurse, and our reasonable conclusion was something very serious was wrong. And even though we called the doctor, I think they did call us back eventually. I'm not even sure that we had cell phones 29 years ago. I don't think so. So, we might have missed the call. It might have been a message on the answering machine, but it wasn't quick enough. And, I was looking at it probably about a $2,000 bill.
Yeah.
Right now, I might have made the same decision if it happened today, to
Mm-hmm.
be quite honest with you. But I can't help but think about all of those people that go to the emergency room. I know I have a friend of mine who lives down in Florida, close friend of mine. His kids go to the emergency room. It seems like that's where they think their healthcare is. They have no relationship with a doctor. There's no one to talk to. They
Mhm.
can't get them to understand that every time they go, it's $1,000, it's $2,000, and they walk out feeling fine. It's something that probably could, be resolved with telemedicine, right?
Yep.
Or, maybe if urgent care was available, and it is for them, they don't even understand that. They're not paying the bill. Let's put it that way. If they start paying the bill once, if he hands them the EOB and the invoice from the facility, I'm sure they'll make a better decision next time.
That's right. That's right.
What type of services do you help employers and their members avoid? Right? Is it what percentage of the services that are done at a hospital or emergency room, let's say, right?
Uh-huh.
Urgent care center could be handled by EZaccessMD.
Yeah. So, like I said earlier, that about 85% of what an urgent care center does, we can do. So that's quite a lot. And in fact, sometimes if you even went to an urgent care center, if you needed like a Doppler or like an ultrasound, they may not have somebody there that's able to do that, and they got to send you to the emergency room anyhow.
Right.
So there's that compounded factor there as well. But we do as far as like the different things that we avoid, or maybe more specifically, like the common conditions that are treated, it's going to vary by employer. But I'm not sharing my screen right now, but I'm just looking at a utilization dashboard that we use as an example. But in this particular case, it looked like most of the feedback that we gave them, most of the conditions that were treated were orthopedic injuries for this particular customer. And this is a quarterly snapshot dashboard for them. So majority were orthopedic injuries. There was a good chunk of dermatological issues. Then there was some ear symptoms and neurological symptoms, allergy, sinus. So we do give a breakdown to every customer to kind of show them what type of events were being treated, just so that they know. And we also give them feedback in terms of like how many phone encounters were there, how many mobile visits did that result in, so they can really get a good idea of how the service is being utilized, and things like that. So
what percentage of the telemedicine, it starts as telemedicine, what percent actually end up result in also a mobile visit?
Yeah, so it is a smaller percentage, and I don't have the number at hand here, but if I just crunch some numbers here real quick, I can give you an answer just on this particular case in terms of like a percentage.
I'm gonna throw out there 7%.
No, it was actually it was more than, it was about 20%.
Oh, wow. So 1 out of every 5.
Yep.
That's actually pretty interesting. You'd have to think that if an employer had only telemedicine, then that means 1 out of every 5 of those visits would have ultimately ended up in another visit.
Yep.
Right? To an urgent care center. So telemedicine alone is not going to help offset that cost.
Right. Yeah. I mean, yeah, because your chances are you're going to need an X-ray, or you're going to need some sort of a lab test. They can't do that. They have to send you somewhere. So that's 2 separate encounters. But the way we price this out, that per employee per month bundles that together. So that first consult, and if there is a mobile visit that's required, that's all kind of bundled together as one event. So it's not creating more costs, or directing you to an area like a brick and mortar type facility to get these things done.
And then they report back to the doctor, the same doctor that started the process, that initiated the mobile.
Yeah, it just depending on the timing of things, you may or may not get the same doctor, but they're all work for the same. They all have access to the same EMR. So any encounter that's taken place, if somebody's doing the follow up, say, but they didn't do the initial consult, they have all the notes, and they have all the diagnosis, and they have like the ability to be able to give a give them the next steps that they need to follow in terms of their next steps.
Yeah, so not really much different than just going to a regular urgent care center.
Right. Yeah, and and a lot of time, and also what'll happen too is that a few days down the road, we'll check in with the employee as well to see how they're feeling.
Mm-hmm.
And if they're maybe not still feeling well, maybe referring them to maybe a higher level of care because maybe there's something more that's going on. But there is that follow-up visit, and you don't get that with traditional telehealth very often. Sometimes, unfortunately, you don't even get that from your own primary care doctor.
Right.
And I remember, years ago going to my primary care physician. I remember we'd had I don't know, somebody had to go to the emergency room or. But on a Monday morning, he had read a report or whatever and called up to see how I think it was my wife. How's my wife doing? And I didn't even realize that he knew that she had gone to the doctor, because we had the same doctor. But that was back when he was first starting his practice. So he's had the time to do it. Was probably trying to be, provide really good service. But, as his practice grew, I don't get those phone calls anymore. And I don't fault him for that at all, but that's just the nature of it.
I'm just thinking of what happened, just this weekend, right? So my wife, who's a nurse, started, taking high blood pressure medicine. It was the very first night. She just knew it was kind of time. She'd been, putting it off like I did for a while. And she's like, I'm just not feeling great. I think that it's time to go on this. She was put on I don't know the reason, a different medication that I'm taking. And I take mine in the morning, and it's really helped me. But she took it at night, and in the middle of the night, she passed out. She got up. She wasn't feeling great. She went into the other room not to wake me up, and she wasn't feeling great. And she came back into the room and literally passed out. And long story, but we have a platform bed that's very low to the ground because of a problem my dog was having. He had some orthopedic problems, so we got a bed that he can just walk up onto instead of jumping up and jumping down. So I thought he fell off the bed. I woke up with the bang, and I'm like, "Hey, Duncan, you okay?" And I heard my wife at the end of the bed kind of moaning. So she didn't feel great. It was a bad night, and I almost brought her to the emergency room, but didn't. Right, we took her blood pressure at home. We have the equipment there, and it seemed okay. If anything, it was a little low, which could have resulted in her passing on, I guess.
Yep.
Called the doctor's office the next day. The person at the desk answered the phone. My wife explained what had happened. Oh, we'll have the doctor call you back. Well, he never called back. Never. Didn't call back. 2 days later, the office calls back to just say, well, how's it going? And my wife was a little upset. She's like, well, it's not going great because I'm not taking the medicine because I never heard back from the doctor. Never called her back. And to me, I was like, well, maybe he didn't get the message. Maybe the office forgot. Maybe he's, knowing how busy doctors are, and how many patients they have to see just to keep their practice afloat, especially primary care doctors. They're not making a boatload of money, but I can't help but think that if we had this, could have called, would have spoke to a doctor. There's no question.
Yep.
Would have spoke to a doctor. It's not like there's not anybody. It's like Uber, right? When you initiate that thing, someone's picking you up. I mean, it's very rare, especially if you're in Long Island. There's someone driving all times of day and night. Same thing. I mean, telemedicine is built around that, right? It's about getting people to care when they need it the most, which unfortunately our healthcare system isn't. It's not about that. I mean, it should be about that. I think, at the heart and soul of it, I would think that, the practitioners would love that. They're just operating within a system that doesn't always make that possible and allow them to put the patient first.
Yeah, it's true. Just that they're very, very busy, and the system's set up to kind of crank out as many patients as they can, and that's just how it works. But I know, deep down, that doctors probably want to be able to do more than they're able to sometimes, just based on how their workload is set up for them. So it's a tough profession. I give them a lot of credit, and like I said, I think having a primary care physician is very important. But for those things where you're going to go to urgent care, that there's better alternatives out there like EZaccessMD that
Yeah.
are very convenient and again, can help to save healthcare spend for everybody,
What
which
a
is
lot of
great.
people don't understand is that when they have almost, I would imagine just about every health insurance carrier, insurance, company in the country has now embedded some form of telemedicine into the
Yep.
product, almost probably exclusively with third party companies
Right.
like uh, there's just so many of them. The problem is what people don't realize is a lot of them still have a copay for the member. Could be
Yep.
$29, could be $49, whatever that is. That okay, but there's also a claim attached to that, right? That is being
Yep.
processed by your insurance company behind the scenes as a medical claim. So it's not something that's eliminating that claim cost. And at the heart of soul of what we try to do here at BrightPath is help employers understand that if you could better manage your health care costs, then you're going to lower your cost to insure your employees.
Yep.
We don't do that by passing more cost onto the employees by raising deductibles. Actually, it's completely the opposite. We try to give members, additional supplemental resources. I mean, at the heart of everything is an insurance plan.
Mm-hmm.
It's how you supplement it and the people that you choose to do that with to make sure that you have a robust access to healthcare for your employees when they need it the most, so that we're not looking at those, excessive claims down the road because people couldn't afford their medications, couldn't
Yep.
afford to go to the urgent care doctor, and ended up in an emergency room a week later. We hear those stories all the time from people. We try to dig deep. Like, we work very closely with case management companies
Mm-hmm.
who are proactively reaching out to employees to say, well, why did you make that decision? Why did you go to the emergency room? How can we help you? Do you not have a primary care doctor? Let's get you a primary care doctor. Let's find you one.
Mm-hmm.
Did you know you were entitled to preventative care at no cost? You want to know who the best primary care doctor is in your area? We'll help you find that. We'll help
Yep.
make the appointment. And we want people, as you mentioned, a couple of times already, primary care is on life support right now, and it's unfortunate. It is I think it's really the reason why health care and health insurance in this country have deteriorated so dramatically, is because whether it was deliberate or not, they made it very difficult for doctors coming out of medical school to make the decision to go into primary care, right? They're the lowest. They're lowest on the totem pole, right? And they're just not compensated. I think that they should be compensated significantly more than they are. They should be treated fairly. Their workload should be, regulated. They shouldn't be forced to see a patient every 7 minutes.
Right.
It's despicable that the health systems have created this under the fee for service model of healthcare, right?
Yeah.
They've tried a couple of different things, but I think I'm sure you've heard of direct primary care, right?
Uh-huh.
It's pretty big in the world that we're working in, and not super abundant here in New York. I mentioned it on every show. We're fortunate to have one on Long Island, and my daughter is a patient of Dr. Blyskill, and she's amazing.
Wow.
It's just the interactions are robust and plentiful,
Right.
right? And it's also a flat monthly fee. So getting to the fee schedule for a
Mhm.
second.
Yeah.
I didn't pull it up on the slide because it's not really about like selling a product and everything. But what I like about your model is that it's utilization based. It starts
Correct.
very, very inexpensively and then works its way up based on the number of interactions and employee. If I remember correctly, the scale kind of starts at $1 per employee per month, as low as that, up to 20. But there's a couple of different alternative variations. Maybe that's not even
Yeah. So,
the current one.
So it is utilization driven. So we do have like two simple pricing models. One's kind of a flat fee. It's the same every month. And then it has an annual true up at the end of the year where we look back, what was the actual utilization?
Right.
And if it's higher than like that targeted, $12, which is about 60% utilization. If it's less than that, then we would issue a credit towards their renewal year for the
Mhm.
difference. And then that would be their new rates for that following year. So
Right.
on the same token, if they went above that 60% utilization, and a lot of people do, we would issue like just a bill to true up the difference there.
Right.
And then that would be the new rate for the following year. So when you hear like, oh, wow, the rate's going up or it's going down, when you consider the alternative, if you're utilizing our service, if you had not used our service and went to the urgent care center or emergency care center, what would that have cost you in those particular situations? And then we do have another pricing model that, again, it's based on utilization, but it adjusts every month. So really, at the end of the day, you're going to end up paying for what you use, and it's going to be the same amount. It's just kind of how you want to pay for it. Is it a kind of a known steady fee each month, or is it something that's going to have some variability based on some seasonality that happens? Like we notice, like in the winter months, there's more utilization. Summertime, it tapers off. So you'll probably pay a lot less in the summertime, during those summer months. But at the end of the day, you're probably going to end up paying the same amount over a year's time.
So like traditional, the telemedicine that I'm familiar with, right, that we have some of our clients use, a third party independent telemedicine, it ranges at about like $5 to $8 per month, but that's purely telemedicine.
Right.
So with your $12 average, unit cost, PE, and it's per employee per month. So that's for a full family.
Yeah. So the people who are covered, it's going to be every employee is eligible for the plan, whether they're enrolled in the health plan or not. So these don't have to be people that are enrolled in the company's sponsored health plan. They maybe have opted out and maybe they're under a spouses who work someplace else. So that's kind of the health plan, whether they're enrolled or not, is kind of irrelevant. And even if they're part-time employees, they're eligible. It's really if the employer wants to pay for that. And in this, you mentioned the Great Resignation earlier. If you ask a lot of employers, what are some of their biggest challenges? And it's being able to find good people, and being able to keep the good ones that they have. And much like salaries are important, and how much you're paid is important, but your benefits is part of your compensation. So having a robust benefits plan that includes something like EZaccessMD and some of the other strategies that you put in place can go a long way in helping employees to feel valued and to feel loyal to their employer by having a great benefit package.
Yeah. So, I mean, to me, it seems like it's a great supplement for an employer that has, no option but to offer a high deductible health plan type scenario, right? So that they can supplement that for $12 per employee per month. So if 100-person group, that's $1,200. Sounds like a lot of money, but that's probably 3 or 4 urgent care visits.
Right. That's one X-ray,
Right? Yeah.
So
absolutely.
Yeah.
And the doctor's cost, so the X-ray itself, the office visit, the interpretation potentially, right?
Yeah.
All of the different things. When you go and you don't see what that costs, to find out, hopefully 90% of the time it's not broken. But you have to go to find out. You have to get that X-ray, right? My kids' sports days are done, but I remember back in the day, my son Lewis was a big baseball, football player, basketball. Andrew played lacrosse, and man, that is a physical sport. They played very physically. They were very good. Shout out to him. I just saw one of his ex-coaches last night that I haven't seen in a while, Jim Conan. Great guy, and the boys' team was really good. Their high school team was number 2 in the country, but it was physical, and he was at the orthopedist quite a lot. He did. I don't know if he broke anything actually. Now that I think about it, he had some injuries though.
Yeah,
over
a lot of welts in lacrosse.
Oh yeah, it's a great sport. As you know, I'm a big Ranger fan, so today's a great day for me.
Yeah.
Big win last night. My Ranger jacket is right behind me, but it's physical, and so this also can work. Andrew, for example, my son, he went to school down in Atlanta, and there were very few doctors that were part of our health plan down there. So he had no choice but to go to urgent care. But that urgent care center, the closest one was probably and he was in Atlanta. It's a pretty big metropolitan area.
Yeah.
But he had to go like 15 miles away from school to an urgent care center. So he had to take an Uber, round trip on an Uber. most of the time he avoided it until he was almost on his deathbed.
Right.
And, the health facilities at the college were always closed on the weekend, which to me is ridiculous. Why, they're only open during office hours when the kids have class. So
Right.
he couldn't go. It just wasn't convenient.
Yep.
So this would have potentially, when he was playing lacrosse down there, potentially been a really good solution for him. And I'm thinking of all the times where,
Yeah.
he had to make that trek.
We offer telehealth in all 50 states. So no matter where you are, you'll at least be able to have access to telehealth. But we're in about 30 states with our mobile services and growing. So
yeah.
If he was in Georgia is one of the states that we do have mobile coverage. So, we could have done a lot of things for him if he had something that needed medical attention. And, we can handle a lot of those low acuity things that would go to an urgent care center. Like I said, 85% of what they do there, we can do.
Yep.
So that's a great scenario, and that's what happened with my son. He was living, he was still away to college on Mother's Day when that happened, and his primary care physician is 3 hours away, and it was Mother's Day. So what would have happened there? No, he would have had to go
to Mother's Day, that's for sure. if he decided. So what's the history behind the company? It's got to be, and everyone I talk to, there's a history. When was it formed? Why was it formed? Like, what was the spark that said, "Wow, this is a big void. We can help with this."
Yeah, it's a pretty cool story. I've only been here a short time, but our company's been in EZaccessMD has been around for about 5 or 6 years, but the history even goes back before that. So one of our other divisions of our company that's been around for about 20, 25 years now is called Ultra Mobile Imaging, and they provide mobile diagnostic services, all the services that we provide. But their call points were people that were over the age of 65, mostly people that were living in assisted living, skilled nursing facilities and things like that. So when, an elderly person had a fall at the nursing home, we could come in, do an x-ray and, be able to kind of treat in place. And that's kind of what we're doing here with EZaccessMD now. Just it's a different place, different population. So what ended up happening is, they were just doing great business-wise. They had about 90% market share in the market that they were covering. And they're like, we still have the bandwidth to utilize all this technology for something else. Right. So we started approaching some of our nursing homes initially to cover their employees. And that's sort of how this was born out. So now we're, building a network of other mobile imaging companies around the country that are rendering the service in different parts of the country that are outside of our original footprint. So it's kind of a modern way of building out a network. And we're fortunate that our president and our CEO, husband and wife, Lois and Will Irwin, are very involved in the trade association for the mobile imaging companies around the country. So they're really well connected with all these folks everywhere. So it's really helped us to build out our network.
It's when you think about just the whole landscape of healthcare, there are so many voids, right? I kind of put you guys, it's not necessarily it's not a direct contract, like in the pure sense of things like that we do, some in some cases, but it is, it's something that just addresses such a huge need, right? And it's about, education would be, I would think, something that's important for this, right? You want to keep this top of mind.
Yep.
Is there along with your rolling this out, an employer rolls this out and says, okay, we're going to offer this. How do you work on that awareness, right? To make sure that if they're at the field or they're away at school, that it's the first thing that they think of, as long as obviously it's not life-threatening, right? One of the disclaimers is, if this is a true emergency, go to the emergency room.
Yeah, like I was saying the other day, if you're having chest pain and it's radiating down your left arm and you're a male with diabetes and whatever, you should probably call 911 and get to the hospital. Like we're not going to be the right person to call, but most things aren't like that. They're it's somebody's not feeling well, or maybe they've injured themselves. But anyway, I think I was rambling here. Maybe, could you just repeat the question for me?
I forget the question. What was my question?
It was
Oh,
about
keeping it top of mind. Keeping it top of mind.
being top of mind. So we do offer a lot of support in terms of being able to educate not only the employer but their employees. Like we try to have like a rollout of the service where we'll do an onboarding session, and sometimes we'll even bring in the X-ray machine and the suitcase that you saw, just so they can see what it looks like.
Right.
We have things like magnets they can put on their refrigerator with the number. We also have like keychains that have the number on there, and so just some things to help remind. We also have an app that they can put on their phone that allow them to to hit a button and make the call into EZaccessMD. And when we're doing these onboardings, if we're doing them in person, we'll also just encourage people get your phone out, dial this number, and then save it to your phone so that it's in there. So, and then from there, it's just really kind of educating them, and they get really excited when we tell them that for the employees, that this is free of charge. Like you're not going to have a copay, you're not going to have a deductible, and people get really excited when they hear that. So it's really nice to be able to do that. And then also once they are a customer, like if we notice that somebody's underutilizing the service, we try to work with either the advisor that's working with them or with the HR department to re-educate the company and also the employees there, because we want them to utilize the service because it's good for us and it's good for the employer and the employee to be able to utilize this. So if they're not, it's probably an education gap, and we try to identify that just based on their utilization.
So that a lot of the groups that we're working with, we're self-insuring. We're working with independent TPAs, independent pharmacy benefit managers that have the ability to really provide some really in-depth data. So if you're, let's just say it's an employer that doesn't currently use EZaccessMD, our team and our TPA partners and some of our other solution partners review that data and say, hey, what's the next thing to look at? What is going on with this population that it's not about controlling costs. It's about, are there any gaps in care? Do we have an excessive use of the emergency room? Do we have excessive use of the urgent care center? But we can actually see the codes. We can see the diagnosis. We can see, if they're using those services appropriately, right? Maybe there's a different problem. Why do we have so many people that need that? Maybe there's other gaps in care. But if they are using, getting strep tests, if they're doing these things at urgent care, if they're doing these things at the emergency room, then you can be proactive and bring in and say, hey, this would be a great solution. This is what it cost you last year under your healthcare plan, right? This is what EZaccessMD would cost. And this is the likely return on investment, which, I don't love that when it comes to healthcare, but unfortunately, we have to talk about those things. It is about money. It's an investment that employers making. Yeah,
you want to be able to measure the effectiveness of anything that you put in place, right? To see if this is really providing, the benefit from like a cost standpoint. But again, it's not all about the cost savings too, but it's also about like, building the culture within your company, employees feeling valued. So there's a lot of like intangible things that you really have to factor in. But when it comes to, being able to share data and things like that, every employee would have access to their encounter record that they can share with their employer. That'll show like, I had this consult for this, and this was the outcome, and things like that. So there is ability to share what's happened during these encounters.
Right.
But as far, because it's not generating a claim,
right?
I guess it makes it a little bit different in terms of being able to pull that data.
Right.
Like how it's pulled is going to be a little bit different.
Yeah, and the point is that just that they're using it, right? We know that if they're using it, we know the investment that the employers made, and we know that for each encounter with EZaccessMD, whether it be just purely telemedicine or a combination of telemedicine and the mobile, that we are offsetting costs, but more importantly, someone got access to that healthcare when they needed it the most. So that's what that's just really just trying to draw awareness. It's something that it takes some effort. Takes some effort from an employer. That's why we don't unload too many things on a population. We want to make sure that they're the appropriate things. There's certain things that are automatic.
Yeah.
We know we need to do these things. We know we need to eliminate certain hidden costs and profit centers and misaligned incentives. What we don't know, unfortunately, because there's not much data available from the kind of the status quo,
Right.
insurers that people use. We don't know exactly what's going on until we have that data, and that data is super important. So,
we do have a case study, actually, a white paper that kind of ties into your question a little bit. It was one of our very first customers that was a nursing home, and they were fully insured, and they basically looked at their claims versus the previous year, how much money was spent, and were able to demonstrate that they had reduced their claims and equated it to being involved with having EZaccessMD. And so when it came time for renewal, they actually used that information when they were presented with an increase to say, hold on a minute, we did our part, to reduce our claims. Why are we getting this increase? And they were able to kind of negotiate. I think they ended up with no increase that year based on that negotiation. So it did give them the opportunity to negotiate that increase.
Yeah. Well, at the heart of every single insurance plan are the claims. They're the building blocks of every plan. So when you're talking about the cost to insure your employees, if you can successfully lower the health, the medical and the prescription claims, the expected claims, then you're going to lower all the other things that are on top of it. It's just layering, right? But it starts there. And understanding that is really what's crucial. Too many people think I'm buying insurance. You're not buying insurance. You're buying access to healthcare for your employees. That's like thinking about when you go out to buy a house that you're actually buying a mortgage. Mortgage is how you finance it. Insurance is how you finance the healthcare. You're not shopping for a mortgage. You shouldn't be shopping for insurance. You should be shopping for healthcare. It's a more complicated conversation, but we have to have the conversation if we're going to do anything about it. And with things like EZaccessMD, employers can have a lot more success doing that. So this is our cue. They pulled up our contact information here. We're coming right up on an hour. If anybody has questions for Tim, you have his email, you have his phone number.
And if you're interested in learning more as well, if you go to our websites at EZaccess.com, EZaccess.com, that you can also schedule a demo. So one of either myself or one of our sales representatives can be in touch with you and kind of give you a good, real thorough run through of what we do and how we do it and how it impacts certain things within your business. So
is there any minimum size employer that you're looking to, engage with? Is it 100 employees or more? Is it 20? Is it 50?
It probably would depend on the market and maybe like where they're located. But I would say as long as they're probably 20 or greater, we have plenty of accounts that are of that size.
Right.
But a lot of times they're lumped into an area where we do have a lot of other business too.
Right.
If we just had 20 lives in, say, like a rural part of Montana, may not be the best situation to try to provide the service at the level that we're promising.
Right.
For that, but so that just gives you an example. So, it really kind of runs the gamut from that being the smallest to, we haven't met our largest customer yet. So
good for you.
We're looking to break that record every day.
Awesome. Well, thank you so much for joining me today. This was great. I appreciate it. Hopefully people out there will reach out. We're gonna get this up and running on our showcase page and on Spotify, podcast, things like that. So more and more people hopefully have access to it. We'll review it. Just thank you. Thank you so much for joining me today.
You're very welcome. Thanks for the opportunity, and good luck with everything, and good luck to your Rangers as well.
I was hoping you were going to end with that. That's really the only thing I care about. I'm so distracted by the Rangers right now. This happens every year. I get my heart broken, but maybe this is the year again. We'll see. All right. Well, thanks a lot, man. I'll talk to you soon.
All right. Take care. Bye-bye.
Thank you. Bye-bye.